Hi, beautiful people. Welcome to the last episode of the depression series. In this video, we are going to look at breaking the chains of depression and the treatment options that are available out here. I'm so happy, I'm so excited to bring this series to an end. And if you've not watched my previous videos, please do so you can learn more about depression. So stay tuned and let's get into it. Like I mentioned earlier, depression is a treatable condition, and we have various approaches that can be employed to be able to treat or to manage the symptoms of the depressed individual. So the first approach is the psychotherapy approach, and in this approach, usually the depressed individual approaches a therapist, and under this approach we have like three methods. So we have the interpersonal therapy, we have the cognitive behavioral therapy, then we have the psychodynamic therapy. So the therapist tries to identify and modify the negative thinking pattern of the depressed individual. They go deep into the matter, they try to establish what exactly is depressing you, and they also give you the coping strategies. Like, for example, they can tell you to practice mindfulness, they can tell you to practice deep breathing exercises, they will try to tell you different ways of managing these symptoms, like journaling. Whenever the symptoms try to attack you, they can ask you to meditate, try to do more meditations maybe during the week. So this is what normally happens in a therapy session. And some of the negative thinking pattern could be self-criticism. They try to tell you to stop criticizing yourself so much, that everybody makes mistakes, that no one is perfect, and that you can do anything in any way as long as you are trying to make attempt. Yeah. The second approach is the antidepressant treatment. This one is usually administered by a psychiatrist. So once you get there, they do some diagnosis on you. They're able to tell the type of depression that you're suffering from, and based on the symptoms that you display, they're able to find a combination of drugs that can help you get back to your moods. So examples of these drugs include the selected serotonin reuptake inhibitors. It's called the SSRIs. We have the SNRIs, and we have the tricyclic antidepressants, among others. And if you don't get back to your normal moods with this treatment, usually the depressed individual is subjected to another level. There is another advanced level of treatment. So if you're using antidepressants and it's not working, please don't give up, because we still have more advanced treatment when it comes to handling the type of depression that you're suffering from. The third approach is about lifestyle. So you can incorporate lifestyle changes, like, for example, you can start doing regular exercises. You can try to make sure that you eat balanced diet. You can prioritize sleeping, adequate sleep. I mean, maybe you can start sleeping 8 hours. Maybe during your work time you strain a lot, you overwork maybe more than 8 hours, you strain your body. That's what I mean. So try to sleep more, try to practice mindfulness, try to do deep breathing exercises. And there's a quote that says that movement is the lifeline of depression, meaning that if you stay in one place thinking about your stress or thinking about the things that stress you, that's when depression thrives. But if you move, you try to move your body, you try to do exercise, your brain kind of shifts the attention from the stressors or the causes of depression, and that way you are able to kind of somehow find a way of fighting depression. The fourth approach is the brain stimulation therapy. This kind of approach is usually at an advanced level when all the other methods have failed to work. So in this kind of approach, the brain is usually stimulated using the magnetic pulses, and we have two methods that is normally applied. We have the electroconvulsive therapy, then we have the transcranial magnetic stimulation. So the victim is subjected to this kind of stimulation, and it helps alleviate the symptoms of depression. Lastly, we have support groups. You can join a support group that people discuss and share experiences. You can try to utilize self-help resources like books, and depressed individuals are able to find solace when you're trying to share your story with someone who is also experiencing the same thing. So you kind of feel you belong to a group and a sense of community. This really helps you to move through the steps and be able to get through your healing journey with others. So this one helps a lot, and it's the common approach that people normally use. And with time, you'll be able to get better. Thank you so much.